Welcome, everyone. In this episode, we are going to talk about national guidelines of physical activity and whether those are a friend or a foe for PA promotion. And we have a great guest for today's episode. Our guest is working as a professor of physical activity and health in University of Bristol. His work revolves around themes of physical activity and especially on physical activity policies. Ladies and gentlemen, please welcome our guest, Professor Charlie Foster. Welcome, Charlie.
Thanks, Ollie. It's a pleasure to be here and delighted to be finally part of your epic podcast series.
Thank you. Nice to have you in the podcast. So if we start with the National Physical Activity Guidelines, could you give us a short history what they are?
Yes, sure. So all of us who work in physical activity promotion have this sort of rubric, this central thing that we hold on to, which is about promoting physical activity. So how much we promote is really based on what we call these national guidelines. And these are recommendations for how active adults or children or special populations need to be in order to achieve mainly health benefits. And usually there's a sort of specific prescription of how much time or how frequently or how intense. But they've been around for a long time, exercise guidelines. It's not just a recent thing since the mid-90s. The ancient Greeks had them. Hippocrates had a guideline on how much exercise you should do every day, also including hand washing. So probably good lesson for our time now. So these things have been around for a very long time. And what we're trying to do is understand where they've come from and why they matter and what they could do for us going forward.
I didn't actually know that the ancient Greeks had it. So how was their MVPA recommendation?
Well, I think it's pretty brutal. It was clearly organised for military participation, which, of course, the irony for most fitness training was it had a military purpose. If we think about the muscular Christianity of the Victorian era in England, that was entirely about providing healthy young men to go off and fight for the country. We saw that again in the sort of Ling system, the Swedish gymnastics, all those sorts of things. We've been around for a long time as a sort of discipline, but we've not really understood perhaps where we've come from. And wouldn't it be great? Let's do another podcast about the history of physical activity, where it's come from. But we'll do that another time.
That would be great, actually. So earlier it was a military purpose. Is it now a workability, or what do we try to achieve now with the recommendations?
That is a really good question, Ollie. And that's one I've been struggling with. Not because, we don't know what they do, because they are basically, statements of how active you need to be to achieve a certain level of health benefit. But their purpose can be across a number of things. They can be used for setting targets for populations, as a kind of a measure for surveillance, perhaps a conversation starter with a patient in a clinical setting about activity. It could be for communicating messages to the public. And of course, at an individual level, it's about helping you maintain good healthy physical and psychological health. But why do governments have them? Well, it's a good question. I mean, not all governments do, which is why the WHO have produced their global guidelines so people can adopt them. But, in other countries, they've been around for a while and they do keep changing, and which is obviously based on the science. But their purpose isn't, and this is something that some of your listeners might disagree with me about. They're not here to actually change population behaviour. And they're not there. They don't do that. There's no magical kind of, it's a bit like astronomy. Just because Jupiter's in a particular part of the sky doesn't influence your behaviour. Just because we have physical activity guidelines doesn't mean your population will become more active. And you know that feeling when you read the opening paragraph of a paper when you're reviewing it and you say, we've had physical activity guidelines for 20 years and yet the population prevalence of inactivity remains stubbornly low. Well, yes, They're not designed to do that. So, I think they're there for the reasons I've given, and I think they're probably still trying to work out what they are trying to do. But their original desire clearly was to give safe, effective advice for a population to know something which will help them maintain their health. And unlike smoking or alcohol messages, it's about a relational behavior, about doing something as opposed to not doing something. That's a long answer for you.
Yeah. So do we have the philosophical basis behind them, that why do we do this? Or is it kind of people think that we have it, or have we actually really thought it through, that why they are there?
That's a really nice point. I think they're there because they kind of have been medicalized, and I know my sociological friends get very irate about the medicalization of risk, sort of personification of risk. You're classified in some way that gives you a level of risk, and that's not really, fair or human for you. But I don't think physical activity promoters particularly feel like that. I think what we have is a kind of target in our heads about how active is kind of the recommended level, and our jobs are trying to help people move up a kind of, almost like escalator is the wrong image, but a set of stairs, and some people are right down the bottom. They're not even in the stairwell in terms of their activity and how they want to do it, even if they want to do it at all, because of their social and economic conditions. There are far more pressing things going on. So I think physical activity guidelines help governments feel good about what they're doing. They're providing the right up-to-date information for people to make choices. But thinking it helps people to make choices is a limitation. And of course, we know that health behaviors are not solely the responsibility of an individual. So, guidelines are part of a system, but not the only part.
I was just about to come to that are the recommendations kind of pushing the responsibility to individuals, kind of neoliberal take on this, that you don't do enough, even if the society or the city or doesn't enable, maybe the neighborhood is not safe. So is it a little bit pushing the responsibility?
I think it could be seen like that. I think what I'm pleased about with the new UK guidelines, and certainly some of the other international guidelines I've seen, that kind of tyranny of the threshold, that 150 minutes that you've got to kind of just get yourself over, because 145 minutes, that's not good enough, So what we are doing now is valuing the activity that lies below that line, and recognizing our populations are at various different behavioral stages. And just banging on to say you've got to reach this level, you've got to keep doing, you've got to go up to 300 minutes a week. I spent 3 years working clinically with patients in the Midlands and in England, deprived working class communities, and their lack of physical activity was not their most important health behavior in their heads. We could have a conversation, and they did recognize it would be helpful and useful and good, good in a kind of sense that they would feel better. The acute effects is really what they were after. But the sort of the long-term kind of, reducing cardiovascular disease, et cetera, that's not necessarily perhaps in people's heads. So I think you're right. There could be a way it could be seen as sort of, Big Brother-esque. And in fact, in George Orwell's 1984, there is a scene where Winston Smith is encouraged to do his daily physical activity, and he's being monitored. And you can almost hear his heart beating harder and harder and harder as he gets more stressed in the beautiful writing. But, that's not what we're after. I think we're after is giving people a direction of travel, recognizing they have a choice, capability, and opportunity, and that's not equal across society, and hopefully allowing them to take steps, but also have environments that support them and policies and support them, and the economic and financial conditions that also support them to do that. Because getting yourself active just because the job you do isn't a leisure time choice.
And I think it's quite interesting that most of the countries have similar recommendations. I'm not sure if it's that the World Health Organization makes something and countries kind of adapt it a bit, But basically, we just have kind of threshold that you should go over this, and then it's fine, even though it's more is better
Yeah,
approach
yeah,
basically in
yeah,
everything until a certain limit, which most of the people will never be at. So how about, like, for example, heart rate zones? You have the basic endurance, speed training, maximal. You have these, like, could we have the recommendations in a way that we would have the whole spectrum, not just that get over this threshold and you get, what do you get, kind of quite good
yeah.
health?
Yeah.
Yeah,
I love it. I suspect you might be a bit of a physiologist, Ollie. It's
in a
somewhere
way.
in the background there.
Yeah.
So I'm a behavioural scientist. Physiology is something I let cleverer people than me do. But I think you're right. But what you're looking to describe is a translation point of the guidelines into different metrics that people could choose to value. And the classic one that people always throw at me is, why don't we have a step count as a physical activity recommendation? Because there's expensive devices we put on our wrists and they tell us how many daily steps we have. I think that's one metric, but what it has to do, we have to communicate the guidelines in a way that people will find helpful, and different ways of making the threshold real for folks and real for where they start from is what we're after next. And that's something that I think people globally are challenged by. How do we communicate? How do we use guidelines in a way that's going to be effective? And your example there about heart rate, that different kind of metric, it could be, numbers of stairs climbed a day, miles you've walked, cycles you've done, times you've lifted to shopping. And that's the aerobic metric. But strength, how do we do strength? What's the daily metric for strength? Is lifting your children up 3 or 4 times? I mean, that would probably do it. So it's that translation from an epidemiological threshold to a positive gain frame message. And there's some fantastic work coming out at the University of Edinburgh, led by Chloe Williamson, Nanette Mutri, and Paul Kelly. How do we reshape and relanguage the way we present physical activity to people? And of course, the expertise about that is somewhere where we actually, as scientists, have been reluctant in the past to travel, which is talking directly to the folk it actually matters to. The expertise are the population you want to listen to. So listen to them.
Yeah, and I think it really comes down to how simple you make the message, and then of course you lose something when it's too simple. It's not that simple. And for example, you have this in UK 5 a day for vegetables and fruits.
Yes.
And I think that's quite a simplification. You have like one number and then a preposition, and then a word, 5 a day, and it seems people really know it. And then when you actually look the guidelines more closely, potato doesn't count, tomato sauce in a pasta counts for once or something, nuts once, and so on. So it's actually a big list, but it's a simplification. Do you see that the physical activity guidelines should be as simple, or actually they kind of are sit less, move more? Or how do you see the comparison to 5 a day?
Oh, that's so I have had lots of pressure, and ministers have said to me, why don't we do a 5 a day for physical activity? Why don't we do five things you do in the day that would add up to your physical activity, your kind of daily amount, as it were. And you're right, people claim they know what 5 a day is, but they, and using his own argument he refuted earlier, but they don't necessarily do it. So we know that knowledge, attitude, behaviour link is really broken. We've not had what I would suggest is what's required. It's not just the message, but it's the promotion of the message and the reinforcement of the message, and having a social and cultural and physical environment that supports that choice. If we see that Participation in Canada was running for 10, 15 years, doing really good social marketing kind of messaging around physical activity, and had traction and movement and an effect. But the bundling of the message into something more simple is obviously what communicators like to do, because they want to reduce it down to something that's really simple. Strapline, the kind of the tag for the just do it generation. You can associate that with the product. I think we have to get there, and that's going to require more work. I do love. I'm a bit sad, so I collect international examples of how to promote physical activity, and I do like the Finnish one, which was the sort of pie or the cake version of physical activity. Take a slice from this bit. I just like that as a metaphor. I think it's really good. And there are other nice examples globally. So I think there's an opportunity to bring this intelligence together of different ways of doing things. Clearly, they're culturally specific and appropriate. But just understand the mechanism by which these things can occur, but don't end up with a message that's so kind of meaningless that, it doesn't actually have any traction with the public. So there's a career in some science for someone who's listening, I hope.
Yeah. And how do you see the communication part? For example, you have behind you have a infographic, some kind of a pie format. There's different shapes. I think the modern way would be kind of funny, engaging videos. When do we get like video? I think is today. Infographic is maybe 5, 10, 15 years ago thing in a way. So
this is 5 years old. So this is our pregnancy infographic for health professionals who work with women who are pregnant, and we also have a postpartum one as well. And very right, in 2015-16, it seemed to be a really nice way of simply presenting the guidelines in a way that would be memorable for the professionals who work with those groups. So this isn't public facing, but we did design it with the health professionals, midwives, health visitors, obs and gynae, etc., consultants. And after a lot of workshop and consultation, we agreed some of the language on here, which is actually quite, as you described earlier, quite simple. So one of the phrases on this thing is "don't bump the bump." And the nurses and midwives and pregnant women all understood what that meant. Don't do activities that will bump your bump. The consultants and the doctors hated it because it wasn't specific enough. And I think there we have that great example of the tension between the simplification approach, the desire to be clear, but also the desire to still remain evidence-based. In the end, I called it and we went with it. So,
and
that co-production is really important. I think that's the point I'm trying to get round to. If you're going to make something, talk to people, and they'll help you make it so much better. But you're right, video. So you think video? Why is that?
I think video. Like I just saw the most downloaded apps, and the WhatsApp is the world's most downloaded app, which is communication. But second is actually TikTok, which is like 10-second. Mainly 10-second videos. You can have up to 60 seconds, but that seems to be where we are heading. I'm not sure if it's good or bad, but it's very short videos that people can consume. Like you can just have few seconds, you watch a video, you put the phone away, you watch the next one. So I think communicating, especially for younger people, I think we need to use the formats that they really prefer.
Yes, use the mechanisms, make it funny, engaging, use music that's contemporary and they understand and their parents don't know. Yeah, I'm completely right. And my 16-year-old daughter spends hours on TikTok. I don't know what she's doing, but she follows particular trends, and perhaps we should try and imbibe what we do then. I remember 15 years ago, we wanted to get physical activity messaging into television and radio soap operas as part of a national campaign to kind of normalize it. And that we thought was quite radical at the time because it was all about TV. This is pre-internet. You were far too young. You won't remember that, Ollie. But that was for us quite a radical way. And then we got text messaging. Ooh, this is really exciting. And then we got the internet. And we had web pages, and now we've got a bit of infographic. That was kind of a bit of a stopgap to go on the wall. But you're right. I think we need to understand what are the mechanisms by which people consume information. And the advertising agencies know this. And we have to really start to use that intelligence they have. We have on our communications committee in the UK some folk who work in advertising for exactly that reason. So hopefully we'll start to understand a bit more.
Yeah, and if you think that you want to affect people's emotions or you want to really engage them, text is really boring. Infographic is a little bit better, but why do, for example, cars are almost always advertised with the TV ads? It's, you get the emotion. It's always the nice music background and the car sliding there. So it really affects. It's just the metal box with the wheels. But you feel
I don't have a car, I have a bike. So it's great.
Yeah, me too. We've been able to avoid like the advertisements.
Yes, I've not been seduced by it.
Yeah. But actually, if I go a little bit back, you said about the language in these pregnant women recommendations, and I think that's quite often the problem. Like the academic people are planning these, and then you have people reading, and do they understand kind of phrases? How do you see, how should we approach this?
Well, I think we have to admit that perhaps we've been at fault in the past. We've used this sort of technical language that, to be honest, we kind of invented ourselves. Again, back, if we think about where sports science came from exercise testing and fitness, and the health and fitness industry. And then there was a kind of branch off into the various ologies, psychology, biomechanics, physiology, etc. But then the health bit kind of also flourished. And then we started people talking about, instead of exercise, talking about physical activity and health. So, now we have, in fact, I just looked online last week. We have about 45, postgraduate courses with physical activity and health in the title in the UK. And nearly 100 undergraduate courses with some kind of physical activity in it. So we've professionalized it, but I don't think the public have caught up or perhaps even care. That they might know different. We just finished a nice piece of work. We're interviewing older adults in England. We did about 60, did an hour's interview, effects of COVID, etc., but talked a bit about what they understand about this term physical activity. And they kind of told us it wasn't that relevant. They understand it moving more, taking exercise, doing things that will make you feel better. But the kind of physical activity was almost a product, and it's not a label that they use in their daily lives, talking to their friends over the wall with a cup of tea. So we have to understand that experience and perhaps start to reframe the language. And I was in a conference in the north of England, up in Durham, and one of the delegates asked a question about exactly this, about language. And I said, actually, you just speak to the local population. They probably have their own idioms for walking as they do for weather, etc., etc. And he said, yeah, we need to mank up physical activity guidelines, make them relevant for Manchester. So that's what we want. And a little bit of work we did in Bristol, speaking with local community members from very deprived areas of Bristol. That's exactly what they told us. We have to reframe the language in a way that they understand and make it positive. Don't blame them for not doing it. Encourage them in a way that they'll do that. And I think this is early infancy research, and we need much more of it.